Hi, I'm Jim Treat. I'm a pediatric dermatologist. I'm going to review a few pediatric dermatology pearls from the recent literature. So first pearl is that Giannotti crasti is a very common type of viral eruption in children where they get these papules that aren't especially itchy. They happen on the outside parts of the arms and the legs. They tend to spare the body perfectly. And although the original reports were with various different viruses, including hepatitis B, in the United States, because we vaccinate for hepatitis B, that's a much less common reason. But the new and emerging reason for Giannotti crasti type reactions is molluscum contagiosum and its resolution. When the body recognizes molluscum and it creates a lot of inflammation, then it ends up creating an inflammatory response which looks just like Giannotti crasti with really individual small bumps on the outside of the arms, the fronts of the legs, that again tends to spare the trunk, and it's usually the harbinger that the molluscum is about to go away. Infantile hemangiomas are all about location. So if you think about hemangiomas, you want to worry in certain locations especially. So if you have a beard distribution hemangioma or one that's along the jawline in a child, especially if it's a bigger hemangioma or if it's growing in a pattern, then you worry about the hemangioma being in the airway as well. Nasal tip hemangiomas can lead to destruction of the nasal tip, and therefore, because of that, can need to be treated very quickly in order to prevent that. Periocular hemangiomas can lead to vision disturbances, especially if they're on the eyelid or getting in the way of vision. Lip hemangiomas and perineal hemangiomas can lead to ulceration. Face hemangiomas can leave behind a lot of changes in the skin, and lumbosacral hemangiomas can lead to spinal cord anomalies. Therefore, the location is really one of the main determinants for when we treat hemangiomas, and if you see a hemangioma in one of these locations, you should think about early referral to prevent any risk of infection or permanent scar or pain. Tonsillectomy for psoriasis sounds a little bit extreme, but psoriasis can be associated or caused by strep infections. And so in children, if you have a strep infection and then you get guttate psoriasis, which is many little dewdrops or small bumps of psoriasis all over the body, and the strep is the main driver of that psoriasis, and you treat their strep and they continue to get strep back over and over, if they have tonsils that are large or if they have any reason for their tonsils to be getting taken out because they're having kind of chronic strep infections, it's reasonable to consider psoriasis as one of those reasons also. So if you have psoriasis that's directly associated with strep infections, it's happening over and over, you've done all the conventional therapy such as topical steroids and treating their strep infections, there was a group that looked to see whether tonsillectomy would help. And what they found in the largest randomized control trial was that in 29 patients, they had a large reduction in psoriasis if they took out tonsils in people who had recurrent strep infections. And that's a very reasonable thing to do if you have recurrent strep. Psoriasis, especially if it's severe, can be associated with metabolic disease, and which can also be associated potentially with cardiovascular disease. And this has been proven well in adults, although in children it's not exactly as clear because the studies haven't been as long-term. But in order to prevent cardiovascular disease later on in life, there were some guidelines that recently came out from JAMA Dermatology, which essentially discuss making sure that children have as fantastic a BMI as possible after the age of 2, considering screening for glucose, for lipids, for blood pressure, as well as looking for anxiety and depression, which can be associated with having psoriasis. There also have been a recent number of reports of anti-TNF-alpha medications used for things like inflammatory bowel disease and also for other inflammatory diseases that can lead to psoriasis. And this is paradoxical psoriasis because these medications are also used to treat psoriasis. But if a patient doesn't start out with psoriasis and then they use one of these medicines, it is possible for them to cause flaring of psoriasis de novo. So we want to look out for this in people who have diseases where TNF-alphas are being used and consider whether they need to switch off of the TNF-alpha medication. And some patients have been treated successfully with ustekinumab instead. Thank you. That concludes a brief snippet of pediatric dermatology pearls from the recent literature.